Hello, my name is Dr. Drew Moffitt. I'm Medical Director of Arizona Reproductive Medicine Specialist. In this presentation, we're going to be talking about COVID-19 and infertility treatment. Is it safe? In this series, we're going to talk about what is safe, who is safe, and where is safe. Now, at the very beginning, we need to say that this is what's called a novel infection, meaning this particular virus has never infected the human population before. And because of that, our understanding of the disease is rapidly changing. New information comes out and we need to update our thinking. But there are some areas where clear conclusions are emerging, and throughout this series we will highlight them. We'll start off by talking about what is safe, and then we'll talk about who is safe. Now, when we talk about what is safe, what we're talking about is what do we mean by being safe? Safe from what? And safe compared to what? And then we'll talk about, is mother safe? And then, is baby safe? Well, what do we want to be safe from? Well, we want to be safe from becoming infected. And we don't really know for sure our risk of becoming infected. For example, if we go to the grocery store, what is the chance that we will get the infection? We do, however, know what our chances are of becoming seriously ill, like being hospitalized, once we become infected. And in Maricopa County, Arizona, that's only a 0.36% chance of becoming hospitalized if we contract the virus. And of course, as far as dying, that risk is very low, only a 0.12% chance of dying in Maricopa County once we get the infection. So most of us, when we're trying to decide if we're going to do something and if it's safe, we compare it to something we've already done. So I thought to help understand if this is safe, we would compare a simple trip to the grocery store now to our annual road trip vacation to California before the pandemic. So what is the risk of going to the grocery store? Well, there probably is enough data now for us to be able to estimate that. And in these lockdown times, probably the riskiest thing we do is go to the grocery store, especially when in the beginning we would go there and no one would be wearing masks and there was no real social distancing structure going on. So what was the risk of going to the grocery store? Well, again, I said we can estimate it, so here's how we do that. So we've already said that the chance of dying is about 0.12%. And we know that the percent of people in Arizona that are estimated to be infected is about 5.9%, and that number varies around that number. There's a new study out looking at what is the total chance of becoming infected from all contacts. And this was out of China. And they estimated that the chance of becoming infected from every possible contact was 0.55%, very low. We'll see how that affects your chance of going to the grocery store. So to make this calculation, we have to estimate the number of contacts we might have in the grocery store. So I'm assuming 5 contacts in the grocery store based on that will come in contact with the checkout clerk, the person bagging the groceries, the person in front of us, and the person behind us in the line, and maybe one additional contact as we're picking out our food. And so when we do that and make the calculation, we find that the risk of dying from COVID-19 from a trip to the grocery store is only 2 in a million, and that's based on this calculation. So why am I picking this topic of a grocery store in the first place, since we're trying to talk about how safe it is to go to an infertility clinic for treatment? And essentially because at a infertility clinic, as you'll see, the things that are in place to protect you from getting infected are much more strict than at the grocery store. So any risk of that experience is going to be much less than just going to the grocery store, which in reality is probably the riskiest thing that we do. So given that the risk of dying from COVID-19 from going to the grocery store is really low, only 2 in a million, and that the trip to the infertility clinic is probably even less, is that something that we would be willing to do? Well, again, to decide that, we want to compare that to something that we wouldn't think twice about doing. And so what is your chance of dying from a car accident on a road trip to Santa Barbara, which most people wouldn't think twice about doing that in the summer for a vacation? And you can find the data on car accidents and dying from a car accidents based on certain trip distances. And when you look at that, you come out to that your risk of dying from a car accident on your road trip to Santa Barbara is 35 in a million. So what that means is if you're willing to accept the risk of going on that road trip, you certainly would be willing to accept that risk to go to the grocery store nowadays, and by association, certainly the trip to the infertility clinic. Now that we've clarified what we mean by the word safe and explored just how safe things are compared to the coronavirus, let's now talk about who is safe, specifically how safe is mom and how safe is the baby when pursuing infertility treatment during this pandemic. So let's talk about mom. The main question is, are pregnant women likely to get sicker from COVID-19 than a similar aged person who is not pregnant? Current data suggests that they are not at an increased risk of having a more severe or fatal outcome. Specifically, a recent review stated, quote, "Available data from multiple small series generally suggest that pregnancy and childbirth do not increase the risk for acquiring SARS-CoV-2 infection, do not worsen the clinical course of COVID-19 compared with non-pregnant individuals of the same age, and most infected mothers recover without undergoing delivery," close quote. So what about baby? Well, there are several considerations we want to go over. Does COVID-19 make it more difficult to get pregnant? Does it increase the risk of miscarriage? Does it cause birth defects? Does it cause preterm delivery? And does it cause growth abnormalities or some sort of neonatal complications? Well, at this point, we really don't have any data about whether it makes it more difficult to get pregnant. Preliminary data about miscarriage suggests no increase. Currently, there's no information about birth defects. That's because birth defects mostly occur from exposures in the first 3 months of pregnancy, and COVID-19 started in December of last year, and because of that, babies conceived in October and later are the ones that are at possible risk, and those babies will just start being born around June of this year. There does seem to be some reassuring preliminary data. A recent review stated that in utero transmission from mother to baby does not seem to happen. Quote, "In reviews including up to 51 pregnant women with COVID-19, no cases of intrauterine transmission have been documented. So, if the virus can't get to the baby, no birth defects." What about preterm delivery? Well, the early data is not really clear because it came from severely ill patients or well patients who were delivered as a protective measure, not really knowing what to do. So we don't really know if COVID-19 causes preterm delivery. There's no real data yet about growth abnormalities. With respect to neonatal complications, a recent review stated, quote, "Reports of COVID-19 infection in the neonate have generally described mild disease," close quote. So in summary, the information we have for how safe is baby is that there's no real data for if it affects fertility, no increase in miscarriage, probably no increase in birth defects, probably no increase in preterm delivery, no real data about growth abnormalities, and probably no neonatal complications. So far we've talked about what is safe and who is safe. Now we're going to talk about where is safe. Specifically, is the infertility clinic safe? We're going to talk about transmission between people, transmission from surfaces, transmission from the treatment itself, specifically inseminations, and embryo transfer. At ARMS, we're doing everything we can to keep our patients and staff as safe as possible. Before the first community-acquired cases in Arizona, ARMS had in place policies, procedures, and equipment that exceeded CDC guidelines. Long before the CDC decided it was a good idea, ARMS adopted a comprehensive universal masking policy. What that means is that everybody in the office, both patients and staff, are wearing a mask. Now, this type of mask doesn't protect you from being infected by another person, but it limits your ability to infect another person. When everyone in the office is wearing a mask, everyone is protected. To find out more information about universal masking and the evidence that it works, you can view my video on the topic called COVID-19, A Tale of Two Cities on our YouTube channel. In addition to universal masking, we practice temperature monitoring of all patients and staff. We have a patient flow management system to exceed social distancing recommendations, which includes the use of telemedicine so that you can have your visits in the comfort of your home. Patients only are allowed in the office to reduce the number of people in the waiting rooms, and we have a clinic flow optimization strategy to achieve maximum patient separation. Though transmission of virus from surfaces is less likely than previously thought, ARMS takes the following precautions. Surfaces and patient flow areas are disinfected periodically throughout the day. Hand sanitizer dispensers are positioned throughout the office, and all patients and staff are encouraged to clean their hands after touching any surface. High contact surfaces, such as the doorknobs of bathrooms, are disinfected between each patient, and all exam room surfaces that the patient comes in contact with are disinfected between patients. We also have protocols in place to reduce the risk of transmission from the treatment itself. For inseminations, though partner transmission already exists, to reduce the risk of sperm transmission in other procedures, partners are first tested negative for COVID-19, and then their sperm is frozen for future use. In order to increase the safety of embryo transfer, females are tested for the presence of virus at multiple times during an IVF cycle. Only embryos created from sperm and egg sources that tested negative for virus are stored at ARMS. All other embryos are stored off-site. In summary, though no place can guarantee that your risk of contracting COVID-19 is zero, ARMS feels that through the use of strict protocols to limit transmission between people, transmission from surfaces, and transmission from the treatment itself, ARMS has reduced that risk to well within acceptable levels. In conclusion, in this presentation we have discussed what is safe, specifically in comparison to other things that we think are safe enough to do. Receiving infertility treatment is probably safer. With respect to who is safe, we've shown that infertility treatment and getting pregnant is probably very safe for mother and baby. And with respect to where is safe, ARMS is a safe place to be. Thank you very much for watching this presentation. I hope you enjoyed it. If you did, please share it with someone.